This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello and welcome to Common Health, a podcast brought to you by the Virginia Community Healthcare Association, or VCHA. I'm Dr. Angela Taylor, the Director of the Health Center Control Network and the Center for Data Analysis and Quality, CDAQ, at VCHA, and your guest host for this episode. On Common Health, we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by community health centers here and those who serve them. We'd like to welcome back our listeners. I am so excited today to have Korey Cobb with us. Korey served as the Chief Operations Officer for HealthWorks for Northern Virginia. He holds a bachelor's from Frostburg State University, an MBA from Mount St. Mary's University, as well as a PMP from St. Mary's. He's a member of the second cohort of the Community Health Center University and the class of 2024. Korey was also in the top 50 leaders under 40 in Western Maryland. So Korey, it's the height of football season. Who are you rooting for and why?
Oh my goodness, it's hard to say. I am a fan of America's team. Yes, that's the Cowboys. But unfortunately, they're not doing the best right now. So I've kept my tail between my legs.
You know what? It's okay. I'm a Bears fan, so I feel your pain. Right? Feel your pain. All right. So, Korey, you're a participant in our CHCU, which is our Community Health Center University.
Yes, ma'am.
You are in second cohort of our program, which is exciting. So this program was the brainchild of our PCA HRSA grant. We are doing this for succession planning and leadership development so that our health centers have staff in them that are being trained up. Mm-hmm. I don't know if you know this or not, but our leaders are aging and are going to start getting towards retirement age. And so we're trying to fill those shoes. Mm-hmm. So as part of our workforce development initiative, that's really how the program got started. Mm-hmm. We're getting ready to enter year 3. Very excited. We had 27 applicants. So we had to I had to turn some folks away this year, which makes me sad, but we're doing something right. We are dreaming big. We're trying to take the program nationally and let it stay at U of R and open it up to other federally qualified health centers. But that requires funding. So we're looking at that now.
That's amazing.
Yeah. And we really have built from year 1 to year 2. So if you walked in year 1, it would have been a very different animal. To year 2, we took all the feedback from year 1 participants, from faculty, and from our partner program folks over at University of Richmond and said, all right, we got to kill it in year 2.
Yeah.
So we did some things a little differently. We tried not to schedule classes around holidays. We tried to make sure there was a balance of in-person, not in-person. The thing I think was the biggest change was the application process that you went through, where we had not only the questions that we asked you all, but we had your supervisor and your CEO sign a letter of reference so that everyone in the health center knew that this was a serious obligation, right? Yes. Because you have to go to all the sessions, and then you have to do all 10 of your coaching sessions, right?
We get to do all of our 10 coaching sessions.
Yes, you do. No, I thank you for correcting me. You get to do your sessions and your coaching sessions. And then tomorrow we're going to be doing our capstone project presentations, which I'm so excited to hear. And then we'll be graduating with a certificate from the University of Richmond, which is awesome.
That's amazing.
So that's a little bit about the program. You know this because you're in the program. So when you read the description on our website and you looked through it, what made you say, you know what, this is something I want to invest my time and my talent in doing? What made you want to do it?
Well, I must admit, one of the greatest leaders I've came encounter with was, and is our current CEO at HealthWorks, Dr. Atkins, who actually told me about the program and told me about the opportunity. Then after reading the description of this cohort, I have to be honest, I thought it was a great opportunity for me to continue my growth as a leader and learn from other great individuals who create impact in their communities. And also I wanted to identify skills that help me succeed in this more of a non-space arena. Most of my, I want to say professional experiences for profit. Those other roles would state that they were mission driven, but when you come to HealthWorks and you're working alongside other FQHCs, that's what you call true mission driven. I want to say companies and leaderships and programs that really, I want to say, focus on helping the underserved and helping our communities. And I thought this was a great way for me to kind of, again, quoting the great Dr. Atkins, find what are my blind spots? How can I improve? How can I be better for the people around me?
That's awesome. I agree with you on the nonprofit versus for-profit sector. It's one of the reasons that I love being in the nonprofit sector. Before day one, before you came and sat through orientation and met everyone, what were your hopes for the program? Like, what did you hope to come away saying, I've accomplished X? Or maybe you had a whole list of them.
Well, I wanted to think more, I want to say in depth from a strategic standpoint. I wanted to learn from other, I want to say pioneers in our group. I call the Avengers because when you walk in the room, you got all these smart, you got Kyle, who's a great, legal professional, and you have all these other leaders at other FQHCs that have different challenges that they overcome every day. And I wanted to kind of learn from them to see how I could take some of their strengths and skills and how I can apply it to what I do every day.
Awesome. I will agree with you. This cohort is amazing. Not that the first one wasn't, but I feel like you guys have really come together and had some synergy that didn't happen last year.
Well, what I will say, this is not my first cohort, but what I will say about this cohort is that everyone in the room is focusing on the same thing, which makes it good. Sometimes you may have cohorts that have other leaders from different companies, different industries, but everyone in the room is doing the same thing in some form or fashion, which I think helps generate more synergy. These people I hope to, keep as friends and family for, forever. And to be honest, to take it a step further, and I know this is not a part of that question, but it's kind of a full circle for me. So I'm actually from Richmond, Virginia. And then I've been living in Maryland for I don't know how long. I've traveled, went to Canada and played sports there and lived in other parts of Maryland. So when I got the opportunity to come back to an institution, an educational institution, to be around other leaders in Richmond and that are focusing on making Virginia better, I felt like it was a Cinderella story to me. Obviously, I felt like that. So to me, it's been a wonderful experience, which I'm truly grateful for you guys and obviously HealthWorks and our leadership team there for allowing me to be here.
To come home.
Yeah, to come home. I'm coming home.
And do you feel like you knew when you were going into it exactly what you wanted to get out of it, and then it shifted, or was it you got into it and you went after exactly what you thought you wanted to go after? So did it change any once you got into the program?
To be honest, I came in here with open mind. I'd be lying to you if I had set exact points and where I wanted to specifically grow at. I just know I wanted to grow, and I wanted to learn more. At a certain point in life, when I was in my 20s, I thought I had it figured out, and then I got to my 30s, and I thought I figured out, and then at some point I said, you know what, I don't have it figured out, and I'm still understanding that I don't have it figured out, which means that I want to continue growing and learning from others. So coming to this program, it was great because, and I know you may ask this question later on, but even in our classes, the great thing about this class or classes, meeting with true professors, not just people showing up to just do some PowerPoint training. These are true professionals who are meeting with students, and now they meet with my old behind too. So I kind of felt like I was with my son. I was in school too. But you didn't just learn from those classes. You also got to learn from the people around you related to those subject matters. So what I mean by that is, and I don't know if you guys trained the professors to do this, but they demanded without demanding interaction throughout the courses. So it would be a subject matter, and then others would speak on their experience as well. So not only did you get knowledge and experience from that professor, but then you also got some treats and nuggets from others who also are dealing with some of those same topics,
right.
Whether it be finance, whether it be communications. We had one class that dealt with media, and sad to say, a youth had passed away.
Mm-hmm.
So this was real life information on how do you handle tragic events, how do you communicate effectively and follow protocol from a legal standpoint and from an overall PR standpoint. And this professor is giving us live feedback that's not out of a book. And then you got other classmates, all of a sudden they speak up and say, well, this happened and this is how we handled it. And then it was just a good collaboration. It almost didn't feel like you were in class, but you were in class.
Well, I'm glad that you said that. One of the things that most people don't know when they go into the program, and probably wouldn't know unless we told them, is we do vet all of the instructors for the program. When wants to bring someone to the program, we sit and talk about it. Before you guys go to your session, we meet with that professor every single time, even if it's their second or maybe third time teaching the course, right? And we talk about things like how leadership has changed in the past year, what it means to have issues facing health centers that we know go on every day happening, and so that those folks can adjust from their previous year. So it's not a canned, I'm just going to do the same PowerPoint over and over again that I think you've experienced as well as I have. So we're trying to be very dynamic and responsive to what's going on in the health centers with those professionals. And they're very appreciative of it. I will admit, when I first started, I thought, oh goodness, I'm going to have to go and talk to people that are, way smart at University of Richmond and talk to them about this stuff. But one of the things I found is they really respect the input that comes from the health centers, right? The stuff that you all tell us on a daily basis. So we go a little more in depth than just saying, please teach this class on budgeting and good luck. So I wanted to know if you would describe to our listeners today what it's like to be in the program. Some things around time commitment. We've touched on classes, the coaching, and your capstone project.
Well, I might get in trouble for answering this question because I'm not sure if everyone has the same desires, time commitment as I may have desired to have. When looking at the schedule, maybe some may be intimidating, but when you come that first day, it's like I don't want to call it vacation, but it's like going to a conference, every month or whatever have you of the schedule. It's not a strong time commitment, but when you come, you actually enjoy yourself. Some classmates invited me back to their homes, and you get to build relationships, and then you get to network with people in your groups. So it's almost like when you come, it's another networking, I want to say, conference, because you're meeting with so many different people. But from a time commitment standpoint, honestly, I wish we had more time in person. And that's why I feel like I might get in trouble, because maybe everybody may not feel that way.
Right.
From a class standpoint, I didn't start enjoying school or more so took it serious until I was in my master's program, because they had certain requirements. And then that's when you're really applying the knowledge that you're gaining, so to speak. But I truly enjoyed the time here because I felt like I took away tangible skill sets and tools and knowledge to be able to go apply elsewhere, not just at work, but I can apply it in life. I mean, some of these classes talked about how to identify individuals' strengths and weaknesses and put them in successful situations. We brought up our children, so these principles, I want to say, related to life in general, not just professional, which I think helps you be successful.
Awesome. So I get asked that question a lot. What's the time commitment like, right? And I go over you have to go to classes, you have to go to coaching sessions. And what I tell people is you can put as much time into it as you want, right? But the kind of outside class work is not a heavy lift. It's not a master's program. And we were really intentional about that to make sure that this would be able to fit into the work schedule of someone working in a health center and being as busy as you guys are. So thank you for that perspective.
So I have to add to that point, when you think about commitment, the one-on-one coaching was also fantastic. Nancy Weller, I know she's tired of me. I mean, because when we had our coaching sessions, we would lose time on how long we were supposed to be meeting and go over, and we probably made her late to other sessions or other meetings engagements because it was such a plutonic conversation. The coaching was so genuine. And then on top of that, you take a coach who has the principles and knowledge to help you be better, but also you can relate, not from a professional standpoint, but from a personal standpoint. So I would encourage individuals who sign up for this course not to think about the time commitment, but think about what you can get out of it. Because really, it's not enough time. The knowledge is so rich. The experience is so rich. I don't think it's enough time. These students get to go to class every week, and I only got to go to class every month.
Well, I think that if we could have you guys out of your health centers for that much time, we would. But we would probably get in trouble on that front, right?
Yeah.
So talk to me a little bit about your capstone projects. Tell me what your project's about and what you hope to get out of the future using your project.
Yeah. So I wanted to do something that kind of related to what I was already doing here at HealthWorks, so it could be something tangible. And I can't say that all of it's come to fruition because it's more of a plan. I looked at some of the examples on the document that talked about either, discussing a process that you developed or a plan that you developed. So what I kind of, more so worked on was a plan to kind of overcome some of our demographical challenges that we face in our area and to enhance productivity, which is something that our CEO, Dr. Atkins, has pushed for, and to kind of build on community engagement. So how do you overcome these challenges you face every day to still be successful? And kind of went into some areas and where we've already taken action, and then some things we hope to, take in action reasonably and when we need to make those decisions to do so.
So this is like a living document that your organization's actually taking action on.
Yes, and I would be amiss to say that it was all on me. HealthWorks has a great leadership from our HR, from our director of operations, from our nursing and doctors. This is not Korey's just plan. This is something collectively that we worked on. So this process and plan, I would say, more so goes to all of our staff at HealthWorks, not Korey. It's a team effort. And I think that, and I can say this, and I'll put this on the record, I feel like Dr. Atkins has truly done a great job in leading us to, not sit at the status quo and say, you know what, yes, we're going to get pushed back on reimbursement to be able to serve our underserved, or yes, we're just going to have to deal with, a higher no-show rate because of the underserved that we deal with and some of the social determinants that they deal with every day. She says, no, let's be innovative. And I feel like she's put together a strong team, and I feel like we worked really hard to kind of fight and find a way to still be successful, follow our mission, but act as if we were a private practice while still following our goals and our true values of serving our community.
Well, it sounds like a wonderful way for you to leave behind something for the organization that's a team effort, right? But it's also helped you come along in your career. That's awesome. Ma'am. That's awesome. All right. So, tomorrow's graduation.
Yes, it is.
Yes, it is. So now that you're almost at the end, how did your experience, like when you first started the program, compare to how it's ending?
How does my experience compare to when I first started to how it's ending?
Mm-hmm. Like when your initial expectations were there, mm-hmm. right? And you're like, okay, this is it, compared to how far you've come or haven't come, or, were there any points or hurdles in the program that you were like, oh my goodness?
Mm-hmm. I wouldn't say that there were strong hurdles because our capstone projects and the responsibilities we gave to this class relate to what we do every day. So I'd be lying if I said, it's big hurdles. I'm sad that it's ending. You want an honest answer. I don't know if you want to put that on record. Just being around you, being around Ray, being around our VCHA staff also, which we work with consistently throughout the year. This is I want to say it's an interfaced, inner-ward vision thinking, I want to say, program that relates to what we do. From an expectation standpoint, I feel like I got more out of it. I want to say I possibly underappreciated this experience and didn't realize I would get so much out of it that I can take and apply elsewhere. where it comes to the people and the stories, the memories of what they went through in life and how I can learn from them. Also, we all keep in contact in some way or some fashion. One may send out an email and says, hey, how do you do this? We recently needed to implement an AI policy at our practice because, AI is a way to help drive and be more productive. And I could just reach out to Kyle, and obviously he works for VCHA, but at the same time, he's also my group. So I was like, hey, Kyle, can you help me on this? And we sent a group email out and we were on a call and also talked about it. And Kyle sent me kind of a skeleton from a legal standpoint to kind of get us going. And then I kind of added, the rest that applied to HealthWorks and of course, collaborating with our team. But I feel like that's a counterpart or a gift from this cohort that others can take on. So from a standpoint of expectations, it's more than what I expected.
That's awesome. I'm so glad that that's the experience that you've had.
Yeah.
So is there anything else that you would like to add for those who might be interested in the program for 2026? Because we're full for 2025.
Well, I will say that this is the best class ever. Just letting everyone know, you might not be able to top us. No, I'm joking. What I would say is coming to this with an open mind. Think about your blind spots. Think about areas where you want to grow. Think about your future. Think about where you want to be in 5 years. So when you come to class on the first day, when you have a meeting and you're in front of Tracy, you're in front of Paula, who is also amazing, by the way, Paula, one of the other coaches, and Nancy, and whoever else may be there from a coaching standpoint, wherever that may be at that time, think about what you want to get out of it. So you can come in ready like a sponge to soak in all the information and knowledge and experience that will help you not only improve your practice, not only improve your role in the people around you, but improve you as a person when you go home at night as well.
Well, that's awesome, Korey. Thank you for not only being a part of this cohort, but for sitting down today and talking about your experience. We're, very proud at VCHA to be able to offer this program. We want to continue to see it be successful, continue to see it grow. So having you be a spokesperson and to let people know that maybe if they're intimidated, they could not be, but also some of the experiences that you've had that are yours that I think other people will share as well. So we appreciate you being here. We appreciate everything you do in the community. We know that working for a health center is not an easy task. It's not for the weak. We wish you great continued success.
Thank you so much. I appreciate you. I appreciate your time. And hopefully I can continue on how you guys have helped me grow.
Awesome. Thank you.